Welcome to Great Online Training. Today we're going to discuss about ICD 10 CM Chapter 1 Guideline. From today we'll learn chapter specific guidelines. You can see this section in your book. I think from G7. Please go on G7 page.
G7, okay.
Yeah, G7 page in ICD.
Okay. G7, it is showing official guidelines for coding.
Yes, G7.
Okay.
We are going to learn these guidelines.
Okay.
C part, chapter specific coding guidelines. In this, today we'll start with chapter 1.
Okay.
Okay. So it has many guidelines. You can see 2 pages and 3 pages. 3 pages, around 3 pages are there. 3.5 pages are there. And these are very, very important guidelines in medical. And chapter 1 is certain infectious and parasitic diseases in code range A002B99 plus U07.1 and U09.9. This U series is for coronavirus, as coronavirus comes few years before. That's why it has started. It starts with U character. Okay.
Okay.
Others are old diseases, so it starts with A and B. Let's get started. Topics covered in this class are HIV infection, sepsis, severe sepsis and septic shock, then MRSA, Zika virus infection, coronavirus infection, and lastly we'll see question and answer. We'll try to cover these first 2 points in today's session. Okay. So first, HIV infection. What do you know about HIV? At least you can tell me full.
Human immunovirus.
Not human immunodeficiency virus.
Deficiency virus?
Yeah, just human immunodeficiency virus. And what is AIDS?
AIDS. I know this, but I didn't remember.
You have your
yes. Acquired immunodeficiency syndrome?
Yes. This is I'm telling you every time. You will get each and every answer in your book only. Just you have to
find.
Find it. And you know how to in that answer. Okay?
Yes.
So, acquired immunodeficiency syndrome. Okay? See. So, HIV is human immunodeficiency virus. Is the virus that attacks the body's immune system. Okay? You can see my screen, right?
Yes, I can see.
If the HIV is not treated, it can lead to AIDS. AIDS means acquired immunodeficiency syndrome. Okay. So AIDS is the syndrome caused because of HIV virus. HIV is the virus who causes AIDS. AIDS is the syndrome. If HIV is not treated, it leads to AIDS. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. It means if you find anything HIV related in a patient's documentation, okay, you can code it. But how to use this code and exactly which code you have to use, that it has guidelines for it. And that we'll see in today's session. HIV and AIDS. You can see the difference here. What's the difference? HIV is the virus that causes HIV infection, damages the immune system by attacking CD4 cells. Okay. And what are CD4 cells? CD4 cells are the part of immune system. HIV attacks and kills CD4 cells. Loss of CD4 cells makes it hard for body to fight off infection. So this blue color are CD4 cell and red color is HIV. You can see here years without HIV medication. This is 2 years. CD4 cell count is more and HIV count is very less. Okay, but HIV is present. But if it is untreated, after 2 more years, means after 4 years, HIV get increased year by year, right? You can see till 12 years, most of the CD4 cells get killed by HIV. Okay, so AIDS is the last stage of HIV infection. As HIV infection advances to AIDS, the amount of HIV in the body increases and number of CD4 cells decreases. HIV medication can stop HIV infection from progressing to AIDS. It can't be cured. We cannot cure HIV, but it can be controlled, okay, from progressing to AIDS. Without HIV medication, HIV advances to AIDS in about 10 to 12 years. And possible signs and symptoms include fever, headache, muscle ache, joint pain, sore throat, painful mouth sores, diarrhea, weight loss, and night sweats. Now we'll see guidelines for HIV coding. So first guideline, code only confirmed cases. This is very important guideline. Code only confirmed cases of HIV infection or illness. In this context, confirmation does not require documentation of positive serology or culture of HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV related illness is sufficient. Okay? If your provider says or documented that this particular patient is HIV positive, so if provider's diagnostic statement says that this particular patient is HIV positive or has any HIV related illness, you can code it as a confirmed case. For example, patient with anemia with possible HIV infection. How you can code this scenario?
So in this case, with the above paragraph, we have to use the HIV infection code.
Read it carefully. Read the sentence carefully. Patient with anemia with possible HIV infection.
So we need to code the anemia.
Yes. Not going to code HIV infection because it is possible. Physician not confirm this case, right?
It's not confirmed, yeah.
So here our code will be for anemia D64.9, anemia unspecified. Only the anemia is coded in this scenario because it has been confirmed. It has not been confirmed that an HIV infection is present.
Okay.
The second guideline, selection and sequencing of HIV codes. In this first guideline, patient admitted for HIV related condition. If the patient is presenting with HIV related condition, principal diagnosis should be B20, human immunodeficiency virus HIV disease. Okay. For confirmed HIV disease, we have code B20. Please remember, you have to remember this few codes, so it will not waste your time in examination. If, when you go through this course few times, you will get by at this course. B20 is for HIV, confirmed HIV cases or HIV disease, followed by additional diagnosis codes for all reported HIV related conditions. So it means if patient presenting with HIV related condition, we have to code B20 as a principal diagnosis, and any other diagnosis we have to code after that. An exception to this guideline is if the reason for encounter is hemolytic uremic syndrome associated with HIV disease, assign code D59.31, infection associated uremic syndrome, followed by code B20, which is for HIV disease. Please highlight this guideline.
Yes, I did already. Yeah.
Because this is exception. Otherwise, you have to code B20 as a principal diagnosis. Only in this case, in case of hemolytic uremic syndrome, you have to code that particular syndrome as a principal diagnosis, followed by HIV. For example, HIV with PCP, pneumocystis carini pneumonia. Okay. In this case, we have to code B20 for HIV as a principal diagnosis, followed by B59 PCP. Okay. Pneumonia due to pneumocystis carini is an HIV related condition. So the HIV diagnosis is present, reported first, followed by code. Patient with HIV disease admitted for unrelated condition. That guideline was for related condition. Now this guideline is for HIV disease, patient with HIV disease admitted for unrelated condition. If a patient with HIV disease is admitted for an unrelated condition, such as traumatic injury, okay, the code for the unrelated condition, for example, nature of the injury code, should be principal diagnosis. Other diagnosis would be B20, followed by additional diagnosis code for all reported HIV related conditions. Okay, means this patient, if patient has HIV disease, but currently that patient is admitted for some unrelated condition like injury. Okay, injury is not caused because of HIV. Right? So in this case, we have to use injury code first. After that, we have to code B20. Clear? This is one example. Unstable angina, native coronary artery atherosclerosis plus HIV is there. So here we have to code I25.110 for unstable angina. Okay, and after that we have to code B20, human immunodeficiency virus disease, because that atherosclerotic artery disease and unstable angina are not related to HIV. So those conditions are reported first using combination code, and HIV is reported second. These two conditions have, here in this example we have three conditions. Okay, unstable angina plus native coronary artery atherosclerosis plus HIV.
Yes.
Okay, and patient, here I have not mentioned, but patient admitted with this unstable angina and all. So we have to code, and we have combination code for this too. We have to use the combination code as a principal diagnosis followed by B20 code.
How do we know that it has combination code?
Your alphabetic index will guide you. Currently, do not focus on this code. Okay.
Okay.
Because we are learning HIV related guidelines. This is just for it. We're going to discuss guideline for this code also in further sessions. Okay. So just focus on guideline here. How to sequence HIV code. If patient is admitted for unrelated condition to HIV, but patient also have HIV disease, we have to code that unrelated condition first, followed by HIV infection. Okay, clear?
Yes.
So next guideline. Whether the patient is newly diagnosed. Whether the patient is newly diagnosed or has had previous admissions or encounters for HIV conditions is irrelevant to the sequencing decision. Kaposit sarcoma, lymphoma, PCP, cryptococcal meningitis, and cytomegaloviral disease are considered opportunistic infection and always regarded as HIV related. So these are few conditions which are caused because of HIV. To remember these conditions, you will get all these conditions in your book also. Highlight this. These are HIV related conditions. So like just we saw example of HIV and PCP. We have coded HIV first and then coded PCP. Right? The same guideline applies to all these conditions because these are HIV related. Newly diagnosed multiple cutaneous Kaposi sarcoma lesions in previously diagnosed HIV disease. In this condition also, we have to code B20 as a principal diagnosis plus C46.0 for Kaposi sarcoma of skin, because this is HIV related. Okay, even though HIV was diagnosed on a previous encounter, it is still sequenced first when coded with an HIV related condition. And Kaposi sarcoma is an HIV related condition. That's why even though this HIV is previously diagnosed disease, okay, and this is new diagnosis, Kaposi sarcoma is new diagnosis here, but Kaposi sarcoma is caused because of HIV. That's why we have to code B20 as a principal diagnosis.
Okay, got it.
Please go through these guidelines after completion of this section.
Sure.
You will forget it. Asymptomatic HIV, we have code G21. G21 code is for asymptomatic human immunodeficiency virus, HIV, infection status. If you want to search this code, it is better if you remember this code. It's very easy to remember. To search this code, you have to go and search term status. Okay, go on status term in alphabetic index.
Yes.
Okay, and search for asymptomatic, sorry, not asymptomatic, human immunodeficiency virus. You have to search.
Under the status?
Status, yeah.
Okay. Human immunodeficiency virus.
G21.
G21, yes. Yeah.
You have to remember this code. It is easy to remember. B20 is for HIV and G21 is for asymptomatic HIV infection status. Okay. It is to be applied when patient without any documentation of symptoms is listed as being HIV positive or known HIV or HIV test positive or similar terminology. Okay. If HIV disease is mentioned, we have to use B20.
Okay.
Okay. And if symptoms are also there, HIV related symptoms are also there, that case also we have to use B20 only. Okay. But if patient present without any symptoms and
Documentation of symptoms.
without any symptoms and it comes HIV positive or it says like known HIV or HIV test positive, we have to use this Z21. Prepare one table also, so don't worry about it. Let me know afterwards, after learning that table, if you have any. Do not use this code if the term AIDS or HIV disease is used or if patient is treated for any HIV related illness or is described as having any condition resulting from his or her HIV positive status. Use B20 in these cases. Okay. When you have to use B20, that is given in this paragraph, if AIDS or HIV disease is mentioned, okay, or that patient is treated for HIV related illness or any condition resulting from HIV positive status. In that case, we have to use B20. Okay, just confusing between HIV positive and HIV test positive.
No, yes, I'm clear because without the symptoms, we have to use Z21 if it is positive also.
Yeah, that is. Yeah. But here also mentioned if nothing is there about symptoms, not symptomatic or asymptomatic, nothing is mentioned in your report. Just they give you HIV positive or HIV test positive. In that case, also you have to use C21 only, right?
Yes, I got you.
Remember this.
Okay.
Patient is treating for HIV related condition or having symptoms of HIV and it says it's HIV positive. In that case, we have to use B20. This is the flowchart. Patient is seen for a condition and has a symptomatic HIV. Is the condition the patient is being seen for related to HIV? If no, we have to use Z21 to indicate a symptomatic HIV status. And if yes, that condition is related to HIV, we have to use B20 as a first listed diagnosis. Even though that HIV is previously diagnosed and other related conditions, we have to put addition. Clear?
Yes.
For example, patient admitted with acute appendicitis, status positive HIV test on active. Now you tell me.
So first, we have to use the acute appendicitis followed by the Z21.
Yes, correct. So first code will be for appendicitis and then we have to use Z21 and this is appendicitis is not related to Z21 is sequence second since documentation indicates that patient has had positive HIV test but has been asymptomatic. Okay. And being on medication for HIV is not an indication to code B20. Okay. And AAA is mostly used for HIV. But being on HIV is not indication of using B20. Okay. Unless there has yes.
AAA is the test for HIV?
Yeah.
Okay.
So it is not depend which code you have to use is not depend on drug. Okay.
Okay.
I have included this example. So don't go on this drug name. You have to focus on status positive HIV test and this symptom or other condition. The next guideline, patient with inconclusive HIV serology. Patient with inconclusive HIV serology but no definitive diagnosis or manifestation of the illness may be assigned code R75 which is for inconclusive laboratory evidence of human immunodeficiency virus HIV. Previously diagnosed HIV related illness, patient with any known prior diagnosis of an HIV related illness should be coded with B20. Once a patient has developed an HIV related illness, the patient should always be assigned code B20 on every subsequent admission or encounter. Okay, as HIV we don't have any cure for HIV, we have to use this HIV code on each and every subsequent physician documented HIV, even though that is previously diagnosed. Patient previously diagnosed with any HIV related illness, B20, should never be assigned to R75 or Z71, which is for asymptomatic HIV infection status. If patient is previously diagnosed with HIV illness, we have to use B20, and only B20 code we can use on subsequent admissions. Or any doubt?
Yeah, no doubt.
This guideline is just for once patient get HIV infection, HIV related illness, and or patient treated for in previous encounter also. If patient is treated for HIV related condition, okay, in subsequent encounter, if doctor mention that patient is previously treated for HIV related disease or something, we have to use B20 code. This guideline is just for B20 code. This is not applicable for R75 or Z20. And for inconclusive laboratory evidence of HIV, we have to use R75. The next guideline, HIV infection in pregnancy and the puerperium. During pregnancy, childbirth or the puerperium, a patient admitted or presenting for healthcare encounter because of an HIV related illness should receive a principal diagnosis of code O98.7. Highlight this code O98.7, which is for, again dash is here because this is not complete code. Okay, it has other characters also, that's why this is dash is there. But B20 and Z21, R75, these three codes are complete.
Yeah.
Okay, so O98.7 is for human immunodeficiency virus disease, human immunodeficiency disease complicating pregnancy, childbirth, and the puerperium, followed by B20 and the codes for HIV related illness. Codes from chapter 15 always take sequencing priority. Remember, I told you we have separate codes for pregnancy related conditions or each and every condition.
Yes. Yesterday only you told me about the. Yeah.
Yes. So we have sequencing priority for chapter 15 codes. Chapter 15 is for pregnancy related condition. So here, in case of HIV, we have O98.7 code, which is for HIV in complicating pregnancy. We have to use this code as a principal diagnosis, followed by B20 code. Patient with asymptomatic HIV infection status admitted or presenting for healthcare encounter during pregnancy should receive codes of O98.7 and Z20.
Yes.
Same guideline, just you have to use principal diagnosis O98.7. Patient is pregnant. Okay. And if HIV related illness is there, we have to use B20 as additional. If HIV infection status is there, we have to use Z21 as additional diagnosis. Clear?
Yes.
Next guideline, encounters for testing for HIV. If a patient is being seen to determine his or her HIV status, use code Z11.4. Encounter for screening for HIV, use additional codes for any associated high-risk behavior if applicable. Okay. So if patient is seen to determine HIV status, we have to use code Z11.4. Status is not confirmed yet. The patient is just seen for determining his or her HIV status. In that case, we have to use Z11.4. If patient with sign and symptoms is being seen for HIV testing, code the sign and symptoms. Okay, and additional counseling code Z71.7 HIV counseling may be used if consulting is provided during encounter for the test. Okay, so if patient is seen to determine his or her HIV status, we have to use Z11.4. But if patient with sign and symptom is seen for HIV testing, patient already has sign and symptoms of. So if patient is with sign and symptoms of HIV and he's came for a testing of HIV, in that case we have to use additional counseling code if counseling is provided, G71.7. When a patient returns to be informed of his or her HIV test result and test result is negative, use code G71.7 HIV counseling. Again, even if patient is returned to just inform his or her HIV test result and test result is negative, in that case also we have to use G71.7, which is for HIV counseling. Okay. If the results are positive, see previous guideline and assign code appropriate, which is appropriate. Okay. If test results are positive, in that case we have to code as previous guidelines. Okay, but if test results are negative and patient returns to just inform the provider about his HIV test results, in that case we have to use counseling code. This guideline.
Yes, yes.
So this is the table. You'll get clear idea about it. At least you have to go through this table many times. So if the term HIV disease is there or AIDS term is there, we have to do, or AIDS related complex ARC, or AIDS related condition, or HIV infection symptomatic, means symptoms also present. HIV infection symptoms are there. We have to use B22, B24 series. Code from B22, B22. Okay. If we have a symptomatic HIV infection status or HIV positive or just HIV is mentioned or known HIV virus, HIV status, HIV test positive or seropositive, HIV infection asymptomatic. If any of this term is there, we have to use G20. If laboratory evidence of HIV or inconclusive HIV serology or non-conclusive test for HIV is there, we have to use R75. HIV disease complicating pregnancy, we have to use O98.7 plus additionally we have to use either B20 or C21. If symptomatic, B20 and if asymptomatic, we have to use G21 additionally. Encounter for screening for HIV, we have G11.4. For HIV counseling or patients test results are negative for HIV, in that case we have to use G71.7. Then contact with or exposure to HIV, we have to use G20.6. And for family history of HIV disease, we have G83.0. Why there is no code for personal history of HIV?
I don't understand the question.
Here in this table, this is complete table for HIV coding. Okay, I have prepared this table, but here there is no code for personal history of HIV disease. We have family history code for HIV disease, but we don't have personal history for HIV.
No, I'm not getting idea.
Because if patient has history of HIV, you have to use B20 code, right?
B20, yeah, I thought that one. Yes, yes.
That's why there is no code for personal history of HIV. And B20 code we can use for subsequent encounters also. So this is all about HIV. At least go through this table for few times. You will get by heart few codes. At least these 3 code you have to by heart. Okay. And you will get most of the question on this 3 code only.
Yeah.
Okay. So the next topic is sepsis. Next point is sepsis. So what is sepsis? Sepsis is one kind of infection. Okay. So you can see here in this picture, local infection caused by bacteria. Okay. This is somewhere in the lung. This green color. Then this bacteria enter into the bloodstream, and as those bacteria comes into the bloodstream, immune system respond to fight infection. This purple color are immune cell. Fourth stage is bacteria and immune cells spreads throughout the body, causing uncontrolled inflammation. Okay. Once bacteria and immune cells get increased, it causes uncontrolled inflammation in your body. And this infection goes to different parts of the body, different organs of the body, and leads to organ damage and death if left untreated. So whenever sepsis infection is there, it is very, very important to cure that infection, to treat that infection at the early stage only, because if left untreated, it leads to death because it damages most of the organs. SIRS, S for systemic, I for inflammatory, R for response, and S for syndrome. So SIRS means systemic inflammatory response syndrome. This is important full form. Highlight this. Sepsis is a serious condition that happens when the body's immune system has an extreme response to an infection. Infections most often start in the lung, urinary tract, skin, or gastrointestinal tract. So sepsis is a serious condition that happens when body's immune system has an extreme response to an infection. Severe sepsis occur when one or more of your body's organ is damaged from this inflammatory response. And after this sepsis, if when your body's one or more organ get damaged, it is known as severe. And last term is septic shock. It is the last and most severe stage of sepsis, causes extremely low blood pressure and organ failure due to sepsis. Treatment may include antibiotics, oxygen, and medication. That's why it is very important to treat sepsis at the early stage only. We will see stages of sepsis: SIRS, sepsis, severe sepsis, septic shock, and multiple organ dysfunction syndrome, also known as MODs. MODs means, MODS means multiple organ dysfunction syndrome. So, symptoms of SIRS, like patient displays at least two of the following symptoms, at least two of the following, okay? And then sepsis means SIRS with a presumed or confirmed infection. Any of these two symptoms plus confirmed infection is called sepsis. Then we have severe sepsis. It means sepsis with at least one acute organ dysfunction. Then we have septic shock. Next stage, severe sepsis with hypotension refractory to adequate fluid resuscitation. Okay. And lastly, multiple organ dysfunction syndrome. At least two organ failure as a result of severe, persistent, and generalized inflammation. These are the stages of sepsis. First SIRS, then sepsis, then severe sepsis, septic shock, and then MOPS. Now we'll see coding guidelines for sepsis and severe sepsis. First point, sepsis. For a diagnosis of sepsis, assign the appropriate code for the underlying systemic infection. If type of infection or causal organism is not specified, assign code A41.9, which is for sepsis unspecified organism. For example, if gram-negative sepsis is given or is documented, we have to use code A41.50, which is for gram-negative. And if unspecified staphylococcal sepsis is mentioned, we have to use 2 sepsis due to unspecified staphylococcal. And if just sepsis is given, we have to use A41.9. Show you here. If you go on sepsis term, if you search sepsis term in alphabetic index, okay, you'll see the default code or unspecified code is A41.9. Okay, if you click on this code, it says sepsis unspecified organism. Means if organism is not specified, just sepsis is mentioned, you have to use this code. This code, same code is also applicable for septicemia also, and so many synonyms are also there. Okay, but we have so many specific code also. You can see here we have separate code for different types of sepsis depending on causal organism or reason for that sepsis. Okay, so many codes are there. For enterococcus, we have separate code. For Escherichia coli sepsis, we have separate code like this. But if anything is not mentioned, just sepsis is mentioned, organism is not specified, we have to use A41.9. In both the examples above, organism causing sepsis is identified. Therefore, A41.9, which is sepsis unspecified organism, would not be appropriate as this code would not capture highest degree of specificity found in the documentation. Next, the first guideline in this section, sepsis section, negative or inconclusive blood cultures and sepsis. So negative or inconclusive blood cultures do not preclude a diagnosis of sepsis in patient with clinical evidence of condition. Urosepsis. The term urosepsis is a non-specific term. It is not to be considered synonymous with sepsis. It has no default code in the alphabetic index. See here, if you go and search for urosepsis, if you go on the U term in alphabetic index and search for urosepsis, there is no default, right? So don't consider that urosepsis means sepsis. Sepsis with organ dysfunction. If a patient has sepsis and associated acute organ dysfunction or multiple organ dysfunction, MOD, follow the instruction for coding severe sepsis. Okay, if sepsis plus organ dysfunction is also there, we have to follow severe sepsis guidelines. What are those guidelines? We'll go to next point. Acute organ dysfunction that is not clearly associated with the sepsis. If a patient has sepsis and an acute organ dysfunction, but medical documentation indicate that acute organ dysfunction is related to a medical condition other than the sepsis, do not assign a code from subcategory R65.2, which is for severe sepsis. Okay, an acute organ dysfunction must be associated with severe sepsis in order to assign the severe sepsis code. So if acute organ dysfunction is there plus sepsis is also there, there must be association between sepsis and organ dysfunction is given. There and then only we can use severe sepsis code R65.2. If relation between organ dysfunction and sepsis is not given, in that condition you should not use R65.2. For example, sepsis and acute respiratory failure due to COPD exacerbation. Here we have to use A41.9 for sepsis, unspecified organism. As organism is not given, they just mention sepsis. We have to use R41.9 default. Okay. Plus we have to use J44.1, which is for COPD, and J96.00 for acute respiratory failure. Now you can see here, although acute organ dysfunction is present in the form of acute respiratory failure, severe sepsis code, which is R65.2, is not used because in this example they have already mentioned that this organ failure is due to COPD exacerbation. Okay, so they have not given any relationship between sepsis and organ dysfunction. They have mentioned that this organ dysfunction is due to some another condition, like here in this scenario. Okay, that's why we should not use R65.2. Next, severe sepsis. The coding of severe sepsis requires a minimum of 2 codes. First, a code for the underlying systemic infection, followed by a code from subcategory R65.2, severe sepsis. If the causal organism is not documented, assign code A41.9 for sepsis, unspecified organism for the infection, plus additional codes for associated acute organ dysfunction are also written. So whenever there is severe sepsis documented or sepsis with related organ or associated organ dysfunction, in that case we have to use severe sepsis code. Okay, but while coding severe sepsis, we have to use sepsis code also. If organism is given, causal organism is given, we have to code it accordingly. If not mentioned, we have to use A41.9 plus additional associated organ dysfunction code also written. Septic shock. Septic shock generally refers to circulatory failure associated with severe sepsis, and therefore it represents a type of acute organ dysfunction. Okay? For cases of septic shock, the code for systemic infection should be sequenced first, followed by the code R65.21, which is for severe with septic shock, or code P81.12, post-procedural septic shock. For any additional codes for the other acute organ dysfunction should also be assigned. Okay, so we have combination code of severe sepsis and septic shock, which is R65.21, severe sepsis with septic shock. Okay, or we have another code for post-procedural septic shock, P81.12. Whenever we use this severe sepsis with septic shock code, we have to use sepsis code also plus acute organ dysfunction code also. See, this is the flowchart. The patient is admitted with sepsis. There is one question: does the patient have organ dysfunction? If there is no organ dysfunction, report A41.9 or the appropriate code from underlying systemic infection. Means if causal organism is there, we have to select our code accordingly. Okay, and if yes, organ dysfunction is there, in that case, is the organ dysfunction clearly associated with sepsis? If answer is no, report A41.9 or the appropriate code for the underlying systemic infection plus organ dysfunction code. If association of sepsis and the organ dysfunction is not clearly documented, query the provider. And if yes, that organ dysfunction clearly associated with sepsis, in that case, this makes the diagnosis severe sepsis. So our coding will be like A41 for underlying systemic infection, either A41 or appropriate code from that category following sepsis term. Okay. The second code will be report code from category R65.2. Why only 2 is given, 2 and dash? Because if just severe sepsis is there, we have to use, if just sepsis is there, we have to use R65.0. But if septic shock is there, we have to change this code R65.21 because we have combination code for septic shock and severe sepsis, right? I'll show you. Let's complete this. And after these R65.2 code, we have to report additional codes to identify acute organ dysfunction. Show you the codes for sepsis, severe sepsis. You can see R65.2 is non-billable code. Okay, but we have two codes, R65.20 and R65.21. R65.20 is for severe sepsis without septic shock, whereas R65.21 is severe sepsis with septic shock. So we have two codes, one with septic shock and one without septic shock. So that's why here we have mentioned as R65.2 only. Next, sequencing of severe sepsis. If severe sepsis is present on admission and meets the definition of principal diagnosis, the underlying systemic infection should be assigned as principal diagnosis, followed by the appropriate code from category R65.2 as required by sequencing rule in the tabular list. Okay? So, if severe sepsis is present on admission and meets the definition for principal diagnosis, the underlying systemic infection should be assigned as a principal diagnosis. Means if causal organism is not mentioned for the sepsis, we have to use A41.9. Okay. If organism is known, we have to code accordingly. Plus, additionally, we have to use R65.2 to represent severe sepsis. And this is sequencing rule in tabular list. So you click here. We have to go on R65.2 term. If you go on R65.2 code in the tabular list, please go on R65.2 code in the tabular list. Okay, and read guidelines or instructions. There will be one guideline: use additional. Okay, use additional codes for different categories or conditions. If some respiratory failure, kidney failure, or something is there, you have to code it additionally. And also you can see code first note there, which says code first underlying infection such as infection following procedure or puerperal sepsis or infection following infusion or simply just a sepsis. Means A41.9 we have to code first whenever there is severe sepsis is diagnosis. If causal organism is known, we have to use select infection code accordingly. But if causal organism is not mentioned, we have to select default code for sepsis A41.9 and second code R65.2. Then sepsis or severe sepsis with a localized infection. If the reason for admission is sepsis or severe sepsis and a localized infection such as pneumonia or cellulitis, a code for underlying systemic infection should be assigned first and code for localized infection should be assigned as a secondary diagnosis. If the patient has severe sepsis, a code from category R65.2 should also be assigned as a secondary diagnosis. Means if localized infection is also there, plus sepsis is also there, in that case, we have to give priority to systemic infection, means sepsis. And then we have to code localized infection. Plus, if we have severe sepsis also, we can code that severe sepsis and then secondary diagnosis or additional diagnosis. Okay, which is coded with R65. But if the patient is admitted with a localized infection such as pneumonia and sepsis or severe sepsis doesn't develop until after admission, okay, the localized infection should be assigned first, followed by the appropriate sepsis or severe sepsis code. In the first paragraph, reason for admission is sepsis or severe sepsis infection. Okay? In that case, we have to code systemic infection as a principal diagnosis and localized infection as a secondary. And if severe sepsis is there, the secondary diagnosis will be severe sepsis and then we have to code localizing. But primary code will be same for sepsis. Okay? But if patient is admitted with localized infection and sepsis is developed after the admission, in that case, we have to use localized infection code as a principal diagnosis because patient is admitted for that localized infection. And then we can code sepsis or severe sepsis code. With guidelines, sepsis due to post-procedural infections, documentation of a causal relationship. As with all post-procedural complications, code assignment is based on the provider's documentation of the relationship between the infection and the procedure. Okay, whenever you have to code post-procedural complication, remember that code assignment is based on physician documentation of relationship between infection and the procedure. Then only you can use post-procedural complication code. Sepsis due to post-procedural infection. For infections following a procedure, a code from T81.40 to T81.43. Infection following a procedure or a code from O86.00 to O86.03. Infection of obstetric surgical wound that identifies the site of infection should be coded first if known. Okay? Assign an additional code for sepsis following procedure T81.44 or sepsis following an obstetric procedure O86.04 and use additional code to identify infectious agent. If the patient has severe sepsis, the appropriate code for subcategory R65.2 should also be assigned with additional codes for any acute organ dysfunction. Whenever you have to code severe sepsis, when we are going to code severe sepsis when there is acute organ dysfunction present. So always remember that whenever you are going to code severe sepsis, your first code will be sepsis or sepsis. If organism is mentioned, you have to select accordingly. If organism is not mentioned, code will be A41.9, then R65 for severe sepsis, and then you have to additional code acute organ dysfunction. Okay, but in case of sepsis due to post-procedural infection, we have separate code for general post-procedural infection. Okay, and we have separate code for obstetric surgical wound infection. Yeah, because obstetric codes get priority. We have separate code for it. So we have separate code for infection also, and we have separate code for sepsis also in case of post-procedural infection. But severe sepsis code is same. Okay. Next, post-procedural infection and post-procedural septic shock. If the post-procedural infection result in septic shock, first code the sepsis due to post-procedural infection, followed by the code T81.12 post-procedural septic shock. Do not assign code R65.21 severe sepsis with septic shock. Additional code or codes should be assigned for any acute organ dysfunction. See here, this is also very important. If post-procedural septic shock is there, post-procedural infection and post-procedural septic shock is there. Generally, how we code septic shock, we have to use A41.9 or depend on causal organism. We have to select code for sepsis first. Okay. Then R65.21, which is combination code for severe sepsis with septic shock. And additionally, we have to code associated organ dysfunction. But in case of post-procedural septic shock, we have separate code for septic shock. So there is no need to use this code R65.2. We have separate code for post-procedural septic shock and sepsis only. We don't have separate code for, you can see here, severe sepsis. For severe sepsis, we have to use same code. Just a minute, I'll change this. Okay. So we have separate code for sepsis, that is either T81.44 or O86.04. Okay. So if post-procedural infection is there, we have to first code T81.40 to T81.43, any one code of this code range, or O86.00 to O86.03. And then our second code will be, this is for post-procedural infection. Okay. And next we have to code sepsis, which we have separate code for sepsis, which is T81.44 or O86.04. But we don't have separate code for severe sepsis. So we have to use same code, R65.20. Again, but if septic shock is there, we have separate code again, T81.12, post-procedural septic shock. There is no need to use R65.21 because here in this scenario, in case of post-procedural septic shock, R65.21 is replaced with T81.12. This is the example. A 52-year-old male is admitted with septic shock due to a post-operative infection of the small intestine following an appendectomy that has caused acute liver failure. Okay? So here we have to use T81.43XA for infection following a procedure, organ and space surgical site initial encounter. Okay. Then we have to use sepsis code, post-procedural sepsis code, T81.44XA, sepsis following procedure initial encounter. Okay. Then also we have to use T41.9 because the organism, here organism is not specified, that's why we have to use A41.9. Then we have to use, as it has septic shock, we have to use T81.12XA, post-procedural septic shock initial encounter. And lastly, we have to indicate organ. So, case 72.00 acute and subacute hepatic failure without hope. So, whenever post-procedural septic shock is there, we have to use T81.43 code for post-procedural infection as a principal diagnosis. Then, sepsis following procedure code T81.44. Additionally, we have to use code to specify organism, infectious organism. If organism known, you have to select your code accordingly for that particular organism. Okay, under the sepsis category, means you have to search your sepsis category in alphabetic index and select your code according to organism. But if organism is not specified, you have to use A41.9 only. And after that, we have separate code for septic shock also. Okay, 1.12. If this is the case of just severe sepsis, we have to use R65.20. So we don't have separate code for post-procedural severe. That's why. But here, this is the case of post-procedural septic shock. We have separate code T81.12. And additionally, we have to use code for failure organ. This is the table. At least go through this table few times. You'll get by heart all this stuff. As this is starting, you may get confused. I know that once you get familiar with this table, you will get clear idea about it, and you will by heart this all this problems. Sepsis. If just sepsis is there, we have to use A41.9. Sepsis unspecified organism. If organism known, you have to select your code accordingly. Means you have to search the term sepsis in alphabetic index and select your code accordingly. I will show you. You will not get confused. You have to search for sepsis in the alphabetic index, and under the sepsis term we have so many codes, right? Depending on cause of that sepsis or causal organism. Okay, so you have to select your code accordingly. If causal organism is not mentioned, default code we have to use A41.9. So, if severe sepsis is there, our first code will be A41.9. All these guidelines are given in the how to use this course, how to sequence this course for severe sepsis. You will find in the tabular list when you search code for R65.2. Okay, please go on the code R65.2 in the tabular list and read the given instructions carefully. There is one instruction telling you use additional code for acute organ dysfunction, means acute organ dysfunction after using this particular code, and code first underlying infection, okay, which we have coded with A41.9. Code first means we have to use that particular code before R65.2. So whenever you code severe sepsis, first code will be A41.9, sepsis unspecified organism, then R65.20, severe sepsis without septic shock, and plus third code additional code for acute organ dysfunction. And if septic shock is there, again the same A41.9 for sepsis. Second code R65.21. Just the fifth character is changed here. See, if fifth character is 0, it is severe sepsis without septic shock, and fifth character is 1, severe sepsis with septic shock. And plus third code additional code for organ dysfunction. And this is sepsis coding table for post-procedural sepsis. So post-procedural, in case of post-procedural, we have two different categories. Post-procedural infection of obstetric wound, we have separate code, O codes. And for general surgery, we have. So if post-procedural sepsis is there, our first code will be from category T81.40 to T81.4, infection following procedure. And if obstetric wound infection is there, O86.002 to O86.0, infection of obstetric surgical. Then second code will be T81.44 XA, sepsis following a procedure, initial encounter, or O86.04, sepsis following obstetric procedure. Plus third code will be A41.9 to represent sepsis unspecified organism. If organism known, code accordingly. Then for post-procedural severe sepsis, again first three codes are same, okay, and fourth code will be R65.20, severe sepsis without septic shock, and fifth code will be additional code for any acute organ dysfunction. And if post-procedural septic shock is there, again first three codes are same, but fourth code will be changed because we have separate code for post-procedural septic shock, T81.12 XA. Fifth code again same, additional code for acute organ dysfunction. I know this is very confusing, but once you go through this table, just you have to follow these two tables. Okay, this is not just most common. This is common question. Commonly you'll go reports also or question on this. First go through this table. Try to by heart this table, then go through this table and try to by heart this table. At least you have to know the sequence. Okay, so that's it for today. Tomorrow we'll continue next points remaining in this session. And then bye bye. Take care.